Hello, I'm Abby Carter. I'm a nurse practitioner student at Eastern Kentucky University. Today I will be discussing smoking cessation in the pregnant population with the intervention of counseling. Pregnancy may increase stress, making it difficult for women who use smoking as a coping mechanism to quit. Smoking places a threat on the mother as well as the fetus. Smoking during pregnancy comes with several risks, including a higher risk for miscarriage, poor oxygenation to the fetus, and premature births, according to the CDC. In fact, babies born to women who smoke are more likely to have certain birth defects like cleft lip and cleft palate. Approximately 11.3% of females 18 to 49 stop smoking and remain smoke-free throughout pregnancy. This is an alarming number for healthcare providers and requires a call to action. This evidence-based project proposal will work with the adult pregnant population to implement a smoking cessation counseling program within pregnancy and up to 6 months postpartum. Counseling will be an effective way to aid the pregnant woman with smoking cessation within practice and make a positive influence on this vulnerable population that not only affects the mother's health, but also the infant. There were 4 different studies that were reviewed for this project proposal, each offering insight into counseling for smoking cessation. Lee et al., a study performed in 2015, is a randomized controlled trial that determines the effects of theory-guided cognitive behavioral counseling intervention as opposed to the standard self-help treatment. This study, performed in Philadelphia, supports cognitive behavioral counseling. It displayed that at 5 months postpartum, participants in the cognitive behavioral counseling were significantly more likely to be abstinent compared to the control group. This study helped guide the amount of time the client will receive counseling in this project proposal. Jimenez-Monroe, a study performed in 2013, also supported the use of counseling as an intervention. This is a large study performed at a university hospital in Spain consisting of 412 participants. The study findings revealed that the probability of remaining abstinent after 12 weeks was 74% for the intervention group compared to 37% for the control group. It was also found that 90.7% of the intervention group said that they would be ready to quit in the following 6 months versus 18.3% for the control group. Another study that was titled The Effects of Individual Counseling, Line Follow-Up, and Free Nicotine Replacement Therapy on Smoking Cessation in the Sample of Iranian Smokers was performed in 2012. In this study, the intervention included 5 counseling sessions lasting 45 minutes each, using nicotine gum for 2 months, and follow-up phone calls 2 times in the first week, and then once a week for 3 months, and quarterly until 6 months. Results at 3 months and 6 months displayed that the intervention was very effective, with only 13.3% of the control group being abstinent at 6 months and 60% of the treatment group being abstinent. This study also guided the length of the study and supported the telephone counseling in the latter part of the project proposal. The last study reviewed was Bombard et al. That was published in 2013. This study reviewed the use of quit lines among pregnant and non-pregnant women ranging in age from 18 to 44. It was noted that telephone counseling increased quit rates by 60% compared to the self-help material or minimal advice. Each of these studies holds value to nursing practice. They each display that more can be done to assist such a vulnerable population in successfully quitting and maintaining it after pregnancy. This will provide for a healthier life for mother and baby. After reviewing the research, data supports the intervention of counseling for smoking cessation in the pregnant population. This project proposal includes starting counseling at the first prenatal appointment and continuing sessions until 20 weeks postpartum. The plan is to implement this intervention within the local hospital and gynecologist's office. These locations are Hardin Memorial Hospital and Heartland Women's Health Care Clinic. These are both located in Elizabethtown, Kentucky. The first step will be the recruitment phase. Clients will need to meet the inclusion criteria, which is to be pregnant, seeking prenatal care within the first 20 weeks, being a smoker, and having access to a telephone. There will be a verbal recruitment tool that allows the nursing staff to screen patients for smoking and details about how much the client smokes. This form will be provided at each location. Each client will be screened using this tool, and if they do not smoke, there will be no further questions. The counseling treatment will be optional and require voluntary consent, of course, to participate. After signing consent, the client will then enter into the list that has a plan laid out, which will be the first 3 counseling sessions that will be performed in person in the office, lasting 30 to 45 minutes. This counseling session will focus on tactics to quit and remain smoke-free during pregnancy. During this time, the client can also share concerns and stressors that are deterring them from success. The 4th session will occur at the hospital when the client is delivering the baby. The counseling will include the importance of remaining smoke-free even after the baby is delivered. The following counseling session will occur through phone conversation and consist of a 15 to 20 minute phone conversation on the client's progress, concerns, and stressors. Offering open communication allows the client to share thoughts and concerns in a safe environment and make them more likely to be honest and open with the nursing staff. Evaluation will occur in week 20. The client will be asked to self-report their progress at each session, with the ultimate goal being the client has achieved their goal and are now smoke-free by week 20 of postpartum and remain smoke-free throughout life. Thank you.